Is it here or here?
I mean,
I used one.
That was a resting, I don't know what face. Itch face. RIF. Okay, so. I turn around. He's very intensely. He's like leaning forward.
It wasn't.
You were leaning forward. Okay.
Let's just move on.
So we have 5 manual muscle tests on your skills checklist. You've already learned 2. So you've learned upper trap and you've learned levator scap. So those will come back on your lab practical exam. So make sure that you've reviewed those. Okay?
What are the common compensations for those? For the upper trap and the levator scap?
So great question because we haven't covered those. So a compensation for the upper trap is to use lateral flexion of the torso when you're applying that resistance. For the levator scap, that's the one where you'll see a lot of people come out of the elevation. Okay, when you get into the retraction, so you need to make sure that they're in both. You also need to make sure that they're not just moving their arm, that their scapula is staying set. Okay.
Wait, can you restate that last bit?
Yeah. So remember that what we're really looking for is the position of the scapula, because the levator scap is attaching to the scapula, not the glenohumeral joint. So be cautious about not watching where the arm is, which is where we're applying the resistance, but that the scapula is staying. So I'm not sure that's a compensation, but it's something that you need to be looking for, is that the scapula is staying positioned, is fixed.
So it doesn't matter what the arm does, you're saying?
Right. Okay. Right. The first time around, I didn't see people focusing a whole lot on the scapula, and we'll be certainly looking for that this time around. Okay. So we're going to start with the anterior neck flexors. Would you be more comfortable with a pillow under your knees, or are you okay?
Okay.
Okay. So a person could have a pillow under their knees if lying completely flat is uncomfortable for them. Unfortunately, you can't have a pillow under the head for this one. Okay. Now, for this one, we are going to place the arms in a position of a submission or a rest. There you go. Hands up. The reason that we do that is that if you have the hands down at the side, it's easy to push into the table. So that's the common compensation if you don't have them in the correct test position, is that people will push into the table to elevate their head. Another common compensation is that people will actually lead with their chin, causing hyper extension of the upper cervical spine. Okay. So we want a relatively flat chin and to lead with the forehead. So you don't want them to lead with their chin as they come up. Okay? So Michael, what I'd like you to do is I'm going to have you bring your head up off the table, but pretend that there's a string coming out of your forehead and that I'm pulling it up. There you go. Nice, and come on back. So what I'd like you to do, just to show the crowd, is lead with your chin this time, and so that's incorrect. Okay? And back down. So you want to be looking for the person really leading with their forehead and not leading with their chin. So it looked like you had great range of motion. So what I'd like to do this time is apply some force to see how strong those muscles are in the front of your neck, okay? So I'm going to have you do the same thing this time, lead with your forehead. Great. Now can you hold it there? And relax.
Is there gravity eliminated for this?
This is against gravity. If you wanted to do gravity eliminated, what position would you need to put them in? Sideline. Perfect. Okay.
Would you support the side of the head?
Yes, absolutely. You'd want to make sure the head is in neutral. Also, please be very careful about manual muscle testing the cervical spine, because you can cause headaches if you press too hard. So you really want to make sure that you are matching their force and that you are not breaking them. So you want to be very careful about that, okay? All right, clear?
Would you ask to do gravity eliminated on this coming practical?
You may. So if you have already done 3 of your manual muscle tests, and this is your last one, and your person had 5 out of 5 strength for all of theirs, we would then make this one be less than a 5 out of 5. Okay? Now we may say the patient has full range of motion but is unable to tolerate the test position or hold the test position. We may not make you go into gravity eliminated, or we may. Okay? But for at least one of your tests, the grade is going to be less than a 5 out of 5. Now what you're going to see when we get to the lumbar spine is all of the tests have really quirky grading scales. And so most people are going to be less than a 5 out of 5 there. So the odds are of us taking something else and making into it maybe 25%. Okay. Yeah, to have perfect core strength. Okay, so this is our anterior, oh, he already switched it for me, good job. So for our anterolateral neck flexors, we are primarily testing the sternocleidomastoid with some contributions to this from the scalenes, okay? So for this one, we're gonna have Michael turn his head 20 to 30 degrees. Now he's turning away from the side that we're testing. The reason that's important is when we test the posterior lateral neck extensors, we're actually gonna turn towards the side that we're testing. So it's going to be easy to get those two confused. For neck flexors, we are testing the side that we are turning away from. So Michael, if I can have you turn towards me, there you go, good. So what side, if he's turned to his right, what sternocleidomastoid are we testing? Left, good.
We're always testing the side that's facing the ceiling.
Right. Okay. We're always assessing the side that's facing the ceiling, whether anterior or posterior. Okay, you have to be up like that again, okay? So now what I'm gonna have you do is just bring your head straight up like you did before with your head twisted like that. Okay, come on down. So you, Michael, did a little bit, so you're like this, and then you came up kind of in line with your chin. What I want you to do is turn your head and then come straight up.
Like that?
I'm gonna go like, there you go, like that,
gotcha.
right, like
Okay.
that, okay?
All right, boom.
Okay, good, and go ahead and relax. So this time when you come up, I'm gonna go ahead and apply some resistance, okay? And go back down. You only need to be turned a little bit, not a lot of it.
Okay.
And so you're turned almost as far as you can go. So I'm gonna have you come halfway back. A little bit, follow my finger. There you go, good. Okay, hold it there. And relax. It's sore. Excuses. So what now? So for the anterior neck flexors, we were pressing in a straight plane. Now we're pressing perpendicular to that rotation. Okay. So now we're resisting that lateral flexion and the flexion. Okay.
What are compensations?
So the compensations for that one, thank you for asking, is you're going to see them come out of rotation to try to recruit their other anterior neck flexors. So you're going to see people coming out of that, particularly if your pressure is more flexion than the lateral flexion.
So they
The
come out of rotation into more just flexion?
Yeah.
Okay.
The other thing is, again, if you don't have them in the correct test position, they're going to be able to push with their hands to get some pressure. So if you had your hands down here and you lifted up your head, can you imagine that you could push into your hands to try to elevate your upper body? So if you have them in the incorrect test position, what I may do is say, what is a common compensation for this, to see if you come up with getting the hands up. Okay? All right, so then the next one is on your stomach. And I'm gonna have your feet hanging off, so if you can slide down a little bit for me. Now, so on this one, Kendall says that the arms should be up again. But I find that if I have patients' hands up in that position, they're pushing with their hands, because now they're in that sphinx, they're gonna push up into that sphinx position. So for this one, I personally have the person put their hands at their side. So I'm gonna put you here, there you go. So it's exactly the way Michael has done it. He's turned to one side. So which side is facing the ceiling? Left side, so we're testing left. So Dr. Bryant's hint is an awesome one, okay? So for the posterior lateral extensors, you are turning towards the side that you're testing, okay? So Michael, now what I'd like you to do is just lift your head up off the table. Good. Now I'm gonna, okay, you go back down. So this time when you come back up, what I'm gonna do is apply some pressure, okay? And relax. Okay.
Straight down.
So no, I'm applying that oblique pressure again. Now, you can go ahead and be more comfortable, because that was it. So the one thing that so can you imagine if you had your hands up higher that you would push with your hands?
Mm-hmm.
Okay, so I do it with the hands down. So that's a common compensation, is to push with the hands. I overcome that by keeping the hands down. you'll see in Kendall that she talks about having the hands on. For gravity eliminated for this, you're not going to have the person in that rotation position and going into extension. You would go into sideline and have that person just do straight extension. Okay? You wouldn't do the rotation and then the extension in sideline. You would just do the straight extension.
What would be gravity eliminated for the anterolateral flexors?
Would also be in sideline, and you would do the same thing. You would take that rotation component out. Okay? And so now you're really getting all of the flexors. And what you'll see on all of the slides, we're testing multiple muscles for all of these. It's not like we're testing individual muscles anymore.
So when you're in sideline for the anterior lateral ones, you're just testing flexion then? But how is that not different than from the anterior?
It's not. So it's similar to what we had with the supraspinatus and the deltoid, is once we go gravity eliminated, we're really just seeing what they can do functionally for that motion. Okay? So those are